Today, we report on studies presented at the 2016 ASCO Annual Meeting that focus on improving quality and access to care. Welcome to Enclave News Network. I'm Gina Columbus. A large proportion of patients with advanced solid tumors receive at least one form of aggressive care within the last 30 days of their life, according to results of an analysis presented at ASCO. The most common form of aggressive care was hospital admission or emergency room visit, which occurred in 65% of patients. Fewer than 1 in 5 patients utilized hospice care. However, ASCO's Choosing Wisely Top 5 list of recommendations strongly advise against cancer-directed therapy in patients with advanced solid tumors who are unlikely to benefit from it. Instead, the focus should be on symptom-related palliative care. This marks one of the first and largest studies to date investigating end-of-life care for patients under the age of 65. Commenting on the results, lead study author Dr. Ronald C. Chen, an associate professor of radiation oncology at the University of North Carolina, said, "While it can be difficult to predict when a patient is nearing his or her final month of life, we need to do a better job of scaling back dose-directed treatment and transitioning patients to symptom-directed end-of-life care sooner. Intensive care at the end of life remains appropriate for some patients. Still, we need more education of both patients and physicians to improve conversations about goals and expectations." There are large differences in median retail prices for 23 cancer drugs in 7 different countries. The United States is reportedly the highest, while the lowest prices were identified in India and South Africa. The analysis presented during ASCO is one of the largest studies on differences in cancer drug prices between countries worldwide. Additionally, after monthly drug price is expressed as a percentage of domestic products per capita at purchasing power parity, cancer drugs appear to be less affordable in low-income countries. This is despite the lower retail prices the study found. The median monthly retail price ranged from $1,515 in India to up to $8,694 in the United States for patented drugs. For generic drugs, the median monthly retail price was the highest in the United States at $654, while the lowest was $120 and $159 in South Africa and India, respectively. In terms of the ability to pay, cancer drugs were found most affordable in Australia. Commenting on the results, lead study author Dr. Daniel A. Goldstein, a senior physician in medical oncology at Rabin Medical Center in Petah Tikva, Israel, said, "This study provides a glimpse into prices and affordability of cancer drugs around the world and sets the stage for further research. However, the implications of our findings are limited because we were not able to take discounts and rebates into account, which would better predict drug affordability." In breast cancer, preventative surgery can substantially reduce the risk of future breast and ovarian cancer in patients with BRCA mutations. However, a population-based study presented at ASCO showed that African American women are less likely to receive such surgeries compared with white or Hispanic women. In the study, among the 92 women who tested positive for BRCA mutations, African American women had the lowest rates of both bilateral mastectomy and oophorectomy when compared with Hispanic and white women. Commenting on the results, lead study author Dr. Tuya Pal, a clinical geneticist at the H. Lee Moffitt Cancer Center and Research Institute, said, "People only benefit from genetic testing for cancer risk if they act on the information the test reveals and receive appropriate follow-up care. Our data showing lower uptake of risk-reducing surgery among minority BRCA carriers may prompt clinicians to provide more intensive, targeted follow-up efforts, especially for Black women." That's all for today. Thank you for watching Enclave News Network. I'm Gina Columbus.